Glad to meet you all in this pleasant evening. This is Dr. N. Punitha, Associate Professor of Physics Department. A warm welcome to all of you for the fourth day of Virtual Healthcare Week conducted by St. Joseph College of Engineering. First of all, I would like to thank God for giving me this opportunity to meet you all once again, and also I extend my sincere thanks to patrons of our college and head of the department for the guidance to conduct this program. Only few things are useless in the world. One of those is smile. When a new day begins, dare to smile gratefully. When we get into a picture taken, everyone says, smile, smile please. Just we do it by open our mouth and show our teeth. Happier we look. It's because our teeth are important in many ways. There is a well-known proverb in Tamil, Palponal Solpochu. I find immense pleasure in introducing an energetic person, Dr. K. Vijay MDS, FICOI. He is a consultant dental surgeon, prosthodontist, and implant specialist with over 14 years of clinical experience. He is currently the clinical director of Jade Dental Multispeciality Dental Hospital, a state-of-art gallery at Kovilpatti, and also a consultant with numerous other hospitals. After a brief period of service as dental officer with the government of Tamil Nadu from 2009 to 2013, he went on to complete his fellowship in the International Congress of Oral Implantology, USA in 2014. He also obtained advanced training in fully digital implant treatment protocol, Spain in 2018. He is one of the few in South India to carry out all on four guided surgery treatment protocol with novel biocare implants, Sweden. He is a member of various reputed professional bodies like International Team for Implantology, International Congress of Oral Implantology, and Indian Prosthodontic Society. His fields of expertise includes digital dentistry, cosmetic dentistry, and smile designing. I invite Dr. Vijay to take over the session with a smile. Doctor, please.
Shall we proceed, ma'am?
Yes, sir. Yes, you can.
Hello all. Good evening. It's me, Dr. Vijay. And it's my pleasure to meet you all in this forum. And it's my pleasure to discuss with you all some of the common myths regarding dentistry. This presentation may be how one should maintain their oral hygiene. I know you people all are fed up with this all webinars and this invisible corona. Even I am. But remember one thing, the moment once lost is lost forever. We can't regain it. So live every moment of your life. About me, I'm Dr. Vijay. I'm the consultant dental surgeon, prosthodontist, and implant specialist. I'm the clinical director of Jaden Multi-Speciality Dental Hospital. And these are some of the which I plan to discuss with you. These are common myths and facts about dentistry. Let's see one by one. The first myth, people say if there is no pain, the teeth are normal. Here, you have to understand one thing. Most dental issues starts without pain, but the pain starts only when it reaches the advanced stage. At this stage, it becomes not only invasive, but also expensive. To understand this, let's look into this image. Here, first we have to understand. Hello? Hello? Hello?
Sir, yes, sir.
Visible irukka, ma'am?
Illa sir, we are not able to see the screen, sir. Share பண்ணிருக்கேன்.
If it is visible now, ma'am?
Now it's visible, sir.
Okay. Okay, fine. Is it okay, ma'am?
Yeah, okay, fine, sir.
Okay. Here are some common myths regarding dentistry. As I said before, we'll discuss it one by one. The first myth: if there is no pain, the teeth are normal. Generally, people think that if there is no pain, everything is normal. But here we have to understand one thing. Most dental issues progresses without pain. But the pain starts only when it reaches the advanced stage. At this stage, it becomes not only invasive but also expensive. To understand this, we should know the tooth anatomy. This is the first layer, which is called as the enamel, and this is the second layer, which is called as the dentin, and which is soft and porous in nature. And this is the third layer, which is called as pulp. This layer is made up of nerves, and this is considered as the heart of the tooth. And the whole tooth is embedded in the bone. As I said before, we have two main dental diseases. One is the dental caries, and the another is the gum disease. First, let's discuss about dental caries or the tooth caries. This is a bacterial infection, and this is the second layer, and this is the third layer. When the caries is in the first layer, there will not be any pain. As it reaches the second layer, there will be a mild sensitivity, and when it reaches the third layer, there will be a pain. Of the tooth, and the second layer, usually restoration is advised. When it reaches the third layer, the treatment option will be root canal treatment. Even in this situation, if it is left untreated, this will go for extraction, that is the removal of the tooth. And here is an x-ray to show one is a root canal treated teeth and other is a restored or a filling treatment done tooth, and other is the normal. Let's see how a composite filling is done.
Repairing a small cavity, a composite filling can restore your tooth function while also mimicking the tooth's natural shade. During the first step, your tooth is prepared by removing the decayed portion, leaving a small area that will be filled with the composite. Next, a special bonding agent is applied to the prepared area. This bonding process helps to ensure that the filling will attach to the natural tooth structure. A special curing light is then used to set the bonding fluid. Your dentist then applies the composite material to fill the prepared area and shapes it to match the contours of your tooth surface. Again, using the special curing light, the shaped composite is hardened to resist the forces of the opposing teeth. As a final step, composite filling to strength and appearance.
And this is root canal treatment. Usually, root canal treatment will be advised when there is pain or swelling in the gums. Actually, this is the root canal treatment procedure. If there is an infected tooth, usually an opening is done and some endodontic files are used to clean the path, and it is filled with an artificial material called as a gutta and finally, and it is restored with a crown. That's the root canal treatment, which means we are removing the infected pulp, that is the third layer, which is considered as the heart of the tooth, and we are filling with an artificial rubber-like material called gutta and sealing it. Let's see step by step how a root canal treatment is done.
Nothing looks, feels, or functions like your natural teeth. And with the right care, your smile can last a lifetime. But problems like decay, disease, or injury threaten teeth. And thanks to advances in treatment and technology, many teeth can be saved. One way a tooth can be saved is with a procedure called root canal treatment, also known as endodontic treatment. Endodontics is a specialized area of dentistry focused on treating disease or injury to the dental pulp. Endodontists are dental specialists with advanced training in root canal treatment. They are experts in saving your natural teeth using state-of-the-art technologies like microscopes and digital imaging to treat you quickly and comfortably. Let's take a step-by-step look at a modern root canal procedure. Here is a healthy tooth. Inside the tooth, under the white enamel, is a hard tissue called dentin. Inside the dentin is a soft tissue called pulp. The pulp contains the tooth's nerves and blood vessels. It extends from the crown of the tooth into the roots of your teeth. If the pulp becomes inflamed or infected, your endodontist will remove it, relieving your pain or discomfort. Here's how root canal treatment works. First, your endodontist will numb the tooth so that you won't feel anything during the procedure. A small shield isolates the tooth, keeping it dry and clean. An opening is made through the crown of the tooth and into the pulp chamber. Fluid is put in the canals to kill any bacteria and help rinse out debris. Then, the pulp is removed. Using small instruments, the endodontist carefully cleans and shapes the canals. After the space is cleaned and shaped, the endodontist fills and seals the root canals. In most cases, a temporary filling is placed to close the opening until you see your dentist. After your endodontist is finished, you must return to your dentist to have your tooth properly restored with a filling or crown. That protects the tooth and is important to ensure the success of your root canal treatment. That has had root canal treatment often lasts a lifetime, so you keep smiling with confidence.
So it's a must that everyone should have a regular checkup every 6 months. So it is a myth that if there is no pain, normal. Let's second topic. This is a common myth. Generally, people think if the professional cleaning will result in enamel loss. Usually, people say professional cleaning or the scaling is the reason for the sensitivity of the teeth, and which in turn causes the mobility of the tooth. This is not so. To understand this, let's see this image. Here, this is the gum disease and the bacterial infection of the tooth. Usually, the big bacterial infection begins at the crown portion and it slowly enters towards the root portion. The initial symptoms will be there will be bleeding of gums. The advanced or the final stage only, there will be loosening of teeth. So the treatment option for this will be scaling. To make this image makes it very clear. This is a healthy gum and tooth. If you do a scaling at this situation, there will not be have any sensitivity or mobility of the tooth. This is a gingivitis. This condition is called as stage 2, and it is a gingivitis condition. As the name says, it's an inflammation of the gums. At this stage, if you clean the tooth, this will result in a mild sensitivity, but it usually has a good prognosis. And the third stage is called as a periodontitis. Here, the infection not only invades the gums, it also reaches the bone. At this situation, if the scaling is done, this will result in sensitivity and a mild mobility. And this is the fourth stage, that is an advanced periodontitis condition. Here, to the maximum, it would involve all parts of the bone. At this stage, usually cleaning is not advised because the tooth will be mobile in condition. Thus, the sensitivity or the loosening of the teeth is not due to professional scaling. It is because the scaling is not done. Here, this is a clinical scenario showing the healthy gums and the infected gums. Usually, the normal gums, it will be a coral pink in color, and the infected gums, it will be reddish in color. And how a professional scaling is done.
Sometimes cleaning may be recommended by your doctor. Harmful bacteria and hard tartar deposits called calculus build up on your teeth above and below the gum line, releasing toxins that cause gum disease, also known as periodontitis. Unfortunately, this buildup occurs in areas that can't be taken care of by brushing, flossing, or even a regular dental cleaning. Over time, as periodontitis progresses, it can lead to increased inflammation, bleeding, receding gums, and receding bone tissue. And root planing is a specialized procedure that removes excessive calculus and bacterial deposits beneath the gum line, and is usually performed with a hand scaler and an ultrasonic cleaner, which uses high-frequency vibration to separate the calculus from the tooth. This procedure is for advanced periodontitis cases, and in many cases is so extensive that it must be done in stages. It may require multiple appointments to complete in order to ensure you are as comfortable as possible during the procedure. By removing the deposits and bacteria, this procedure is in many cases able to halt the spread of periodontitis. Your doctor will help you determine the next steps for continued rehabilitation of your gum tissue. Are not treated appropriately.
Are called as calculus, and once it is removed, this is the normal condition. When this region is exposed, this we can consider as an gingivitis condition, where a part of dentin is exposed. This gum disease. Let's see what is the cause and how it affects the.
And to be free of pain and discomfort. The mouth contains millions of bacteria, both good and bad. In the absence of regular mouth care, the number of harmful bacteria multiplies, and this can have an effect on the rest of the body. Oral bacteria are the cause of the two most common dental diseases, dental decay and gum disease. Dental decay, also known as dental caries, is caused by bacteria metabolizing sugar in the mouth and producing acid that causes cavities in the teeth over time. Dental decay is linked to the frequency of sugar consumption. Gum disease or periodontal disease generally occurs when ineffective toothbrushing or an to a buildup of back mouth.
Thus, due to some reasons, there is a tooth loss. What are the treatment modalities we have? The myth 3, we'll be discussing about dental implants. Usually, people think these dental implants are a painful and an expensive procedure, and these are meant for only old people. The first point, the dental implants are painful, is not so, due to the advancement in the modern technologies. Second thing, when we consider, usually people say that these dental implants are expensive. To understand this, we should know what are the different treatment modalities available. First is the denture. This is an age-old process, and it has its own disadvantages. Like, actually, it is a temporary prosthesis. And the second option will be bridges. Here, though it has a good lifespan compared to the dentures, it has an disadvantage that we are grinding the adjacent tooth. Here also, once if we grind the adjacent tooth, we can't regain it by any means. And the best option will be an implant. Here, not percentage of success rate. Now let's see what is the difference between this FPD, that's the bridges, and implant, and how an implants are placed, how for and for full mouth.
What possibilities does modern dentistry offer to treat tooth loss?
When one or more teeth are missing, two proven treatment methods are available. conventional bridges, or implant-supported tooth replacement.
Let's have a look at conventional bridges first. To fix a conventional bridge, healthy neighboring teeth need to be ground down and are thus damaged. A conventional bridge is supported by the ground down adjacent teeth. The tooth replacement is not directly attached to the jawbone, it rests on the gums.
The chewing pressure is transmitted onto the adjacent teeth and transferred through their roots into the jawbone. This results in an additional strain on the
This also has an effect on the gums. They reduce as well. As a result, the important support function of the tooth-jaw system is affected and out of balance.
Let's consider alternative treatment. The implant replaces the root of the missing tooth and functions like a natural tooth. Just like a natural tooth. Evenly distributed by the implant to the entire jawbone.
Bone and the gum tissue recedes.
The implant restores the natural chewing function. The important support function for lips and cheeks is preserved. This also works if several teeth are missing, such as with interdental gaps or shortened dental arches.
For edentulous patients, there are multiple possibilities to anchor removable dentures safely on implants. For example, by locators, retentive anchors, double crowns, or bars.
The screw-retained comfort restoration is also a good option.
How does an implant placement procedure work?
Initially, the gum is opened. The bone is prepared using special medical drills. The implant is inserted into the jaw and provided with a healing cap.
Then the gum is closed again. During the healing process, it is important that there is no load on the implant.
Excuse me, ma'am.
Yes, sir.
Ma'am, video clear irka, ma'am?
Yeah, it's clear only, sir.
Okay.
What possibilities does
Comments
What possibilities does modern dentistry offer to? How does an implant placement procedure work?
Initially, the gum is opened. The bone is prepared using special medical drills. The implant is inserted into the jaw and provided with a healing cap.
Then the gum is closed again. During the healing process, it is important that there is no load on the implant, and that the implant has time to integrate into the bone.
The trabecula of the jawbone grow onto the implant and enclose it progressively. The result is a solid and secure connection between the implant and jawbone. The fact that the bone grows onto the implant is a natural process, the so-called integration.
For prolonging outcome, the gum tissue is shaped so that it can be suitably adapted to the planned artificial tooth, the crown. An intermediate component, also called abutment, connects the crown to the implant.
Thus, the new tooth blends naturally into the patient's natural teeth.
Thus, this is the implant procedures. And now let's see for the people who don't have any teeth, dental condition, the treatment option for this will be an all-on-4 technique. Due to some advanced periodontal condition, if you remove all the teeth, right, then the fixed options will be an all-on-4 technique. Here we usually place 4 implants. This holds the whole denture. Hence, these implants are no more than a painful procedure with a modern advancement. This will be a fixed treatment option for those without any teeth. Now let's consider the 4th myth. It is said usually that the baby tooths are not of any importance, and many says that many neglect it. So we have to understand that baby tooth has its own importance. For example, if the cavity is not addressed in the early stages, this will result in early tooth loss, which in turn might lead to ortho braces. This is the main reason. Do you know that this baby tooth provides the necessary space for the permanent tooth? So even the baby tooth has its own importance. Like this helps in the patient chewing habit, that is the nutrition supply, and it also helpful in speech because it's the time that the patient starts to speak. And if there is any pain in the tooth, patient will not take their foods. So even the baby tooth has to be saved. In certain conditions, due to some reasons, if it is extracted, it has to be properly maintained. There are some appliances called space maintainers to maintain them. If not, this will later lead to orthodontic treatments. Let's consider this tooth. This is a baby tooth. Due to the dental caries or due to some other reason, if it is extracted, what happens is, due to the jawbone growth, this permanent tooth tends to move forward, and there is a cycle each tooth at which they will erupt. So this is this tooth. What happens is, this goes in any other direction, which in turn finally leads an orthodontic treatment. So if it is lost, there's a special appliance called a space maintainer with which we should maintain it. So it is better to save all the tooth and have a regular checkup from the early childhood. And the final myth which I want to discuss, and it is one of the most important thing which I would like to discuss with you all. Usually people have a misconception that this dental health is not related to the general health. But now the researchers has proven that there is a strong connection between the periodontal disease, that's a gum disease, and other chronic disorders like diabetic, heart diseases, osteoporosis, etc. Let's have a look at it.
The aim of this video is to explain how poor oral health is linked to a number of general health conditions, and why mouth care really does matter. Bacteria, or toxins produced by bacteria, can be absorbed into the bloodstream and travel to other parts of the body. There's strong evidence linking gum disease and heart disease. Oral bacteria can be absorbed into the bloodstream via inflamed gums and travel to other parts of the body. This may contribute to tiny clots or inflammation in the blood vessels that leads to cardiovascular disease. Infective endocarditis may result when bacteria enter the bloodstream of a susceptible individual and colonizes the lining of the heart, which can lead to inflammation of the lining of the heart. This carries a high risk of bacterial health and diabetes. Gum disease can lead to poor blood sugar control, and poorly controlled diabetes can increase the severity of gum disease. People with diabetes are also at higher risk of developing oral thrush and dry mouth. There's an increasing amount of evidence linking poor oral care to community and hospital-acquired pneumonia. The risk of developing pneumonia is higher in patients who are already compromised. For example, those with dysphagia, who are frail, or who have a learning disability. Regular and effective mouth care to remove bacterial plaque and oral secretions is recommended as a measure to reduce the risk and severity of pneumonia. Hospital-acquired pneumonia is a very common hospital-acquired infection with high morbidity and mortality rates, and extends a hospital admission on average by over a week. There's evidence linking poor oral health to a number of other general health conditions, including stroke, dementia, premature birth, and some types of cancer. However, as this evidence is not as strong, further research is needed. Having a comfortable mouth is important for chewing food. Broken teeth, loose teeth, or a very dry mouth are common reasons that prevent people eating. It's important to carry out regular mouth care assessments for people who stop eating and drinking. Care should be taken to prevent denture loss, which can have a direct impact on eating. In summary, supporting people with good mouth care and promoting the importance of good oral health can have a positive impact on their general health and well-being.
Thus, there is a relation between the oral health and this general health. Would you all like to know the solution for all this dental problem? It's very simple. It's just a proper method of brushing. Now let's see what is the proper method of brushing. There are three important things in a brushing. One is we have to brush twice a day, that is morning and night before going to bed. The second thing is you have to place the brush at an angle of 45 degrees. That is, it should be placed half in the tooth and half in the gum. And it should be a small rolling motion is given and it should be swiped downwards. The purpose of brushing is not to make the teeth brighter. The purpose is to remove the deposits, calculus from the tooth surface. So if it is better if you visualize what you're doing with a mirror, and if you brush it, it will be useful. The second thing is, usually we people forget to brush the lingual side, that is the inner surface near the tongue. This is one of the important surface we usually forget, and the other is the upper and the front inner surfaces. Here we should hold the brush upside down, and then back and up and down motion is given so that we can clean the inner surface of the front tooth. And finally, the occlusal surfaces, that is the surface usually we chew. Let's see in detail slowly how we have to brush it, because this is the most important part of this presentation. Everyone should know what is the proper method of
Today, we're going to demonstrate the ideal method of brushing, that is the modified bars brushing technique and the parts of a toothbrush. A toothbrush consists of a handle, then comes the head, connecting both of which is a shank. Then comes the tufts, and the rows of tufts constitute the brushing plane. The amount of toothpaste to be taken for brushing is of pea-sized. Now we'll move on to the modified bars brushing technique, which is being recommended ideal by ADA for all those who have good manual dexterity, that is skills, and less gingival recession. This technique is indicated for intracircular cleaning and as an ideal remedy for maintaining hygiene. The bristles are placed at an angle 45 degree to the tooth surface such that half of the bristles covers the gingiva and half of them covers the tooth surface. After positioning the bristles at a correct angulation, the small circular motions are given, followed by the teeth are being cleaned at a point of time, and then we move to the next section. But make sure that the last tooth gets overlapped. All the areas of the teeth technique, the bristles are placed at an angle 45 degree and small circular motions are being given. But in modified bars, circular motions are being followed by the sweeping motion, so that even the interproximal areas are followed. For cleaning the palatal surface of upper molars, again the bristles are placed at an angle 45 degree to the tooth surface. Then a small circular motions are being given, followed by a sweeping motion. And for cleaning the palatal surface of upper anteriors, the brush is held in a vertical direction and the teeth are cleaned with the help of a circular motion and then a sweeping motion. Accordingly, the mandibular molars are being cleaned. After positioning the bristles at a correct angulation, circular motions are being given, followed by a sweeping motion. Technique, the most introducible sulcus. For cleaning the lingual surface of mandibular molars, a similar technique is being applied. And for cleaning the lingual surface of mandibular anterior, again the brush is held vertically and small circular motions are being given, followed by a sweeping motion. In order to clean the occlusal surface of all the teeth, the bristles are held perpendicular to the tooth surface and the occlusal surface are being cleaned with the help of a horizontal scale. In similar fashion, even the occlusal surface of maxillary molars are being cleaned. Hope this video helps you to keep your oral hygiene clean.
This is the proper method of brushing. And now let's see what are the tips for proper oral hygiene maintenance. I give 5 main tips. 1, brush twice a day, morning and night. It's a must that everyone should brush at the night before going to bed. Visit your dentist every 6 months. This is not only for professional cleaning, even for an oral examination, because if there is a caries in the initial situation, it can be treated well, than going for a root canal treatment. Then vitamin D, the main sources from sunlight. It's better to go for a walk early morning. This is mainly for children because this is the main source of calcium. Regarding their diets, it is advised to take fruits and vegetables, but it is more important to have a like carrot and apple, because this is a natural food. It destroys, this sugar does not destroys teeth alone, even it destroys our body. So the mantra for oral hygiene is a good oral hygiene without any risk factors and a proper regular checkup from your childhood will result in an optimal health in your adult or in early ages. I repeat, good oral health and with regular checkup from the childhood will result in an good oral health in your old age. So you can be confident throughout the life. Finally, I would like to thank my teachers because of whom I am here, and I am blessed to have these kind of teachers. And finally, my strength, that's my Jaden team. And this is my personal number and my WhatsApp number. If you have any queries, any consultations regarding any doubts, you can 24/7, you can message me or you can call me. It's not a problem. Feel free. And finally, I would like to congratulate the creative mind behind this virtual healthcare camp. I would like to thank the organizers for giving me this wonderful opportunity, and also all. Thank you. Regarding, we have some questions, and to the fact, all questions were very interesting questions. Here are some questions. The first question is, what is the right age to put the braces? Actually, it is said that it is 10 to 14 years of age, but this is considered as 10 to 14 years because the growth spurts occurs at this age. Growth spurt is the point where there will be a highest bone growth, so that if there is any deformities or if you want to mold the bone, you can carry out at this age, that is 10 to 14. But the concept now has been slowly changing towards the concept of preventive or interceptive orthodontics. Here, the problem is diagnosed in early condition and it is eliminated. That is, usually what we will do is, we used to go at 10 years of ages to the dentist for these orthodontic braces. But what happens is, if you have met the doctors from the age of 6, he can easily find and rule out that there might be any problem in the future or not. So again, I stress on the fact that everyone should have a regular checkup at least from the age of 6. The other question was whether we have to use a special brush for orthodontic related tools. The answer is yes, because in case of orthodontic brush, we'll be having two types of bristle. One is a hard bristle, which is located at the center, and the other is by the sides we have soft bristle. Purpose is to maintain and clean the face, which has a soft bristles, which is mainly used for cleaning the tooth and gums. So for orthodontic people, it is better to use ortho brush. Actually, up to what ages you can do maxillofacial surgery? Actually, I think this question is related to something related to orthognathic surgery, because maxillofacial surgery is an open, wide range. Even impacted tooth removal comes under maxillofacial surgery, or even if a removal of mandible also comes under the maxillofacial surgery. I think the question is related to this ortho. So usually for any cosmetic surgeries, it is considered as 18 to 20 degree. That's an orthognathic surgery. Here you have to see one thing. Here, this 3 consecutive questions deals with one thing. That is, if you go for a regular checkup, between 6 to 10 years, you can easily find orthodontic braces treatment. Then if you have left and if you have crossed 16, 17, then a cosmetic surgery will be the option. And we'll be doing this at around 18 to 20 years, because as I said before, the growth spurts, it occurs in 13, 14 at that age. And this growth slowly reduced at the age of 20. So Usually the cosmetic surgeries we will be carrying out, or the implant surgeries, even the implant surgeries we will be carrying out after 10 to 20 years because of good stage. Regarding the healing time of surgery, this is again, this is for the whole body itself. Any surgery in the bone, it will start to heal from 3 days, and the whole healing will take place within 3 to 6 months. So it is not only for maxillofacial surgery, any part of this is very clear. As I said before, the reason is the gum infection. This image makes it very clear. Now, as the patients, as the people ask the question, now only they start with the symptom. That means this here the patient here the person is under the gingivitis condition. So the treatment option for this is, it is the right time to meet the dentist. And the next question was related to the same. Gums are weakened at the age of 35, so the teeth gets loosened earlier. Is this due to hereditary? Again, here we have to note that the gums are getting, the tooths are getting. That means and condition called advanced periodontitis, because he himself says that the tooth has been loosened. And finally, we put the blame on the hereditary. Though hereditary might be the reason, to the maximum 90%, this will be due to improper maintenance of the oral hygiene. Now, for this patient, at least now we have to meet the doctor. Usually, during my early practice, I used to say to my patient that everyone should have scaling every year. Then slowly I asked the patient to brush at least clean once in 5 years at least. Then I asked the patient to undergo scaling at least for once in a 10 year. Now I am in a position, I'm asking the patients to undergo a basic scaling procedure once in a lifetime. That's the condition of the patient. So it's a must that everyone should go for a regular dental checkup. The other thing is, what causes bad breath? Bad breath, there are two main causes. One is the systemic cause and another is the local cause. These local causes are due to, these are the main causes. 90% of the bad breath is due to this reason. Either due to the bacteria accumulated in the oral cavity or the tongue, or the two main diseases, that's or the gum diseases. And there are foods which causes bad breath, and the other main reason is smoking. To eradicate this, proper brushing technique will result in. But there are also other causes which causes bad breath, or tonsillitis, sinusitis, digestive disorder, lung disease, and constipation. Any digestive disorders might also result in this bad breath. So, what are the procedures to get rid of this bad breath? The first option will be having regular dental checkup. This will, to the 90%, this will reduce all your problems. If not, consult your dentist and he will subscribe or he will give the next level of treatment. So the main cause will be the local factors. That is, if you brush daily, morning and twice, a proper brushing technique is important. And regarding the dental phase, is dental safe during pregnancy? It is usually advised no, because it is advised no, but there are certain literature which says when properly done with all protective mechanism, this do not involve any risk to the unborn child. So it is better to avoid. What are the signs of tooth decay? And when can I take my child for dental checkup? Okay. Before the signs of tooth decay, in initial condition, will be root canal. And the second question, when can I take my child for the checkup? This is a very important question, and you will be astonished to see that when the first tooth erupts, you have to meet a dentist. This is the literature which shows you have to meet the dentist within the 6 months within 6 months or during when the first tooth erupts. So at least now you go for a dental checkup have a regular dentist and you can prevent all your oral diseases. So it's a must that everyone should have a regular dental checkup. And regarding this thumb sucking, is it associated with teeth alignment? The answer is yes, because, and this again is a different, this has a long answer, because the age factor decides. Usually 2 to 4 is an age, it's normally due to oral gratification. Kids used to have their anything, toys, or it's a thumb sucking is a normal habit. So beyond 6 to 8 years, it should be avoided. If not, this will result to deformities in not only in gums, bones, and even it causes proclination of the teeth, and there might be some respiratory problems also. Here is one thing called thumb guard, which is available in the net, and this can, to somewhat, it can eradicate these habits. How many times I can clean through my dentist? Clean through my dentist. Actually, it is it's every year. Again, this is based on the how you maintain your oral hygiene. Your dentist decides that. If you have a chronic smoker, regular smoker, then it's a must that you should have a regular checkup every 6 months, regular scaling every 6 months. Sometimes there are many people who can maintain their oral cavity. In that case, it's even a 5 years once also you can have a professional scaling. It based upon your oral condition that your dentist has to decide. The second thing is, how can you say the proper method of brushing? I have explained it very slowly and clearly. And this electric brush is better than manual brushes. So I don't think there's much difference between this electric brush and toothbrush. The purpose is to clean the tooth, and I usually advise normal brushing. This electric toothbrush is usually, nowadays it has become a fancy item. It is usually, this promote the young children to brush. That's one of the important thing, and it sometimes used for the old people who have some nerve problems, neurological problems. They can use it. Other than that, I don't promote this electronic toothbrush, but now this has become a fancy item. That's all the questions which were asked to me. Now let's see some of the questions what are available. Ma'am, which are in the chat box, ma'am? Hello?
Can you see the question, sir?
No, ma'am, I can't see the question.
So what are the dental, shall I read?
It would be easy if it displayed on my screen, ma'am. Yes, ma'am. If not, you just read this. Hello?
Can you see the question now?
No, ma'am, I can't see the questions.
Shall I read, sir? Hello.
Okay. So what the slides from the presentation. Now I can see the questions. I think the first question is, what are dental sealants and when it is recommended for use on teeth? For these dental sealants preventive mechanism. If the dental caries is an initial condition, we can use this. If it is an advanced condition, if it is the next level, we'll be going for restoration. These are preventive mechanism. If the child is prone to this dental caries, usually if there is this is the most advanced treatment, so that we can avoid future caries. Anyway, this has to be done by a dentist, and you should have a regular dental checkup. This is mainly to prevent the dental caries. Next question. So effective is using braces or retainers? How effective is using braces or retainers? Even after proper use, is advised any chance of realigning as the old. How effective is the braces? Actually, braces are advised for this aligning the tooth. So as anyway, there will be a small growth in your bone. After 20 years also there will be a small growth, so that it tends to move. So it's a must. You should have a regular. So these retainers are mainly used to avoid relapsing conditions. Anyway, even orthodontic patients, every year they have to go for a regular checkup regarding this, how the retainer is, how they are maintaining everything. There might be a small problem, which will be corrected by using these retainers. Next question. Does veneer is a permanent solution? Yes, a proper veneer done is a permanent solution. This is also one of the advanced of treatment, and this is a permanent solution. Yes. Next question. I used to get tooth pain and eye irritation if I have fever. Can I know the reason? I used to get tooth pain and eye irritation. Usually, ma'am, what I said is the fever is the first symptom that body shows that it has some pain, that it has some problems. So, as I used to say to all my patients, that if there is fever, there will be any symptoms like toothache. There might be, and eye irritation also might be there. It's better to a symptom. If any infection, it will show. That's it. Next question, ma'am. Can you explain about jaw locking? How you will reduce it? This jaw locking. சில நேரம் நம்ம வாய் ரொம்ப திறந்தோம் அப்படின்னா நம்ம வாய் சில நேரம் இந்த இடத்துல லாக் ஆயிக்கும் அப்படி. That's called as jaw locking. But usually this happens there is in old age, because ரொம்ப நாளா ஏதோ பல்லு கெட்டாம இருக்கீங்க, ஒரு சைடு பல்லு இல்லாம இருக்கு அப்படிங்கிற ரீசன்ல patient tends to chew on one side. On long term there will be a TMJ complications, and actually it is the most movable joint, and it has to be regularly used. So long term ஒரு சைடு பல்லு இல்ல அந்த சைடு நீங்க யூஸ் பண்ணாம இருந்தீங்கன்னா, இல்ல அந்த TMJ ல ஏதோ ப்ராப்ளம்ஸ் இருந்தது அப்படின்னா, there comes this jaw locking. There are certain methods how to reduce it. Actually we have to hold both the sides of the gum near the buccal surface. We used to say that இந்த இடத்துல ஹோல்ட் பண்ணி downward backward motion கொடுத்தா அது ரெடியூஸ் ஆகும். Usually the maximum this occurs during yawning. So maximum ரொம்ப வாய் திறந்து கொட்டாய் விடுறத அவாய்ட் பண்ணிக்க சொல்றது ஒரு பெட்டர் ஆப்ஷன் ஆயிருக்கு. எனிவே ஒரு ரீசன் வந்து TMJ ப்ராப்ளம் தான் இருக்கு. ஸோ அது என்ன ரீசன்னால உங்களுக்கு அந்த லாக் ஜாயிண்ட் வருது அப்படிங்கிறத நீங்க ரூல் அவுட் பண்ணிக்கிறது பெட்டர். நெக்ஸ்ட் क्वेश्चन. My son becomes weakened at the age of 35, so teeth are getting looser. This is a question we have got yesterday itself, I think. This is due to gum disease, and it is high time you have to meet the dentist. I have answered this question, I think. Next question. How long one has to brush? It's not how long you have to brush, it is how you have to brush. Usually we advise for 2 minutes. The thing is, ஒரு 45 degree angulationல வச்சு நம்ம வந்து ஒரு இடத்த வந்து we can give 5 rolling motions. So in and around it will take 2 to 3 minutes. The important thing is we have to visualize it, because only after visualizing we can see that where is the deposit and where we have to. So ஒரு பேஷண்ட்டுக்கு 3 முக்கியமான விஷயம் சொல்றேன். ஒன்று, காலையில ராத்திரி கட்டாயம் பல் தேய்க்கணும். ராத்திரி வந்து கட்டாயம் பல் தேய்க்கணும். பிகாஸ் ராத்திரி தான் இந்த டென்டல் கேரிஸ், கம் டிசீஸ், நம்ம எதுவுமே மூவ்மெண்ட்ஸ் கொடுக்காம இருக்கனால அதுதான் மேஜர் டைம் அது அஃபெக்ட் ஆகிறதுக்கான சான்சஸ். செகண்ட் வந்து பல்லு தேய்க்கிறப்போ நீங்க கண்ணாடியை பார்த்து பல் தேய்க்கணும். அப்பதான் அழுக்கு எங்க இருக்குன்றது தெரியும். ஸோ தட் யூ கேன் மெயின்டைன் இட். தேர்ட் வந்து உங்க பிரஷ் எப்போ அந்த பிரிஸ்டல்ஸ் விரியுதோ அதான் பிரஷோட எண்ட். அதுக்கு மேலே நீங்க அந்த பிரஷை யூஸ் பண்ணக்கூடாது. ஸோ யூஸ்வலி 3 months ஒன்ஸ் பிரஷ் சேஞ்ச் பண்ணிக்கிறது நல்லது. அகெயின் பிரஷஸை பொறுத்த வரைக்கும் இட் ஹார்ட், மீடியம், சாஃப்ட் அப்படின்னு 3 டைப்ஸ் இருக்கு. இதுல எந்த பிரஷஸ் யூஸ் பண்ணணும்னா ஹார்ட் யூஸ்வலா ஸ்மோக்கிங் ஸ்டோன்ஸ் இருக்கிற பேஷண்ட்ஸ் யூஸ் பண்றது அட்வைசபிள். அண்ட் யூஸ்வலா மீடியம் வந்து நார்மலா யூஸ் பண்ணலாம். ஆனால் now the diet habits வந்து கொஞ்சம் கொஞ்சமாக it's moving towards soft diet. நம்ம பெருசாக எதுவும் கடிச்சு சாப்பிட்றது இல்லை. That's why I said you should have a hard crunchy foods. இது நம்ம நார்மலான சாஃப்ட் டயட்ஸே எடுத்துகிட்டே போகிறதுனால what happens is gums also become softened. So nowadays we are advising soft brushes also to the patients. Usually soft brushes, when gum disease irundhuchina, we will be advising the soft brushes. So it's not how long you brush, it's only how you brush. That's the thing. Is making gap between the teeth is great. Nothing is bad. Sounds of any gum disease. It is so, and how to stop it. Making gap between teeth, we have to see what is the reason where this occurs. For example, usually over 30-35 அப்புறம் நார்மலாகவே gums bone expand ஆகும். இப்போ அந்த கண்டிஷனில் if there is a gap, that's a normal procedure. Usually it occurs. Sometimes this also occurs due to periodontal problems. For example, if there is a periodontal problem, there will be அந்த gums கொஞ்சம் கொஞ்சமாக கீழே இறங்கும். ஸோ நம்ம என்ன நினைப்போம்னா அந்த டீத்துக்கு நடுவில் கேப் இருக்குன்னு. ஸோ இட்ஸ் பெட்டர் டு ஹேவ் அ ரெகுலர் செக்அப். ஒன்ஸ் டென்டிஸ்ட்டை போயிட்டு வந்தீங்கன்னா certain questions I have to answer only after seeing the clinical condition. So better ஒரு டாக்டரை கன்சல்ட் பண்ணுங்க because there are multiple reasons. Next question. For heart patient, what precaution to be taken before usually heart patients வந்து first you should get an opinion from the expert or the doctor whom you go ahead with the cardiac procedures, because dental problem abingiradhu it's a part of your it's a small part when compared to the whole body. So usually if there isn't any emergency, the doctor could inform pannirumana so that he can handle the emergency situation. So it's always better to get a consult, the first thing. And regarding that tablets, there's a tablet called ecospirin or aspirin. These are called as blood thinners. They use பண்றீங்க அப்படினீங்கன்னா blood எங்கேயும் பாடியில் ஸ்டாப் ஆகாம ஃப்ளோ ஆகணும்னு யூஸ்வலாக இந்த டேப்லெட்ஸ் கொடுத்துருப்பாங்க. So what happens is even if you took ஒரு பல்லு எடுத்துட்டோம் அப்படின்னா there might be severe bleeding. Again, again the American Heart Association ஓட ரூல்ஸ் படி டென்டல் எக்ஸ்ட்ராக்ஷன் நீங்க பெருசாக அதை ஸ்டாப் பண்ணணும் அப்படின்றது அட்வைஸ் கிடையாது. Because இங்க எதுவும் ஒரு மெயின் blood vesselsோ எதுவும் இல்லை அப்படிங்கிறது ஒன் ஆஃப் த ரீசன். But the first option is to get the consent from the doctor. The doctor should know that your cardiologist should know you are going for a tooth extraction procedure. Sometimes it is better to avoid within a period of 6 months to 1 year. So get a consent from the doctor. It's always better. It is advisable to clean our tooth medically once in a year. Again, this is based on your oral hygiene maintenance. Usually in patients advice we will be having our car, bike, anything. Anyway, we will be giving every year service. எல்லாத்துக்குமே நம்ம வருஷத்துக்கு ஒரு தடவை ரெகுலராக சர்வீஸ் கொடுத்துட்டு தான் இருக்கிறோம். ஸோ வாட் ஹேப்பன்ஸ், நம்ம ஓரல் கேவிட்டிக்கு ஒரு 6 இயர்ஸில் உங்களுக்குன்னு ஒரு ஃபேமிலி டாக்டர்ஸ் வச்சுக்கலாம். ஸோ ரெகுலராக நம்ம வந்து அவங்கள ஒன்ஸ் இன் இயர் செக் பண்ணிக்கலாம். ஒன்ஸ் இன் இயர் செக் பண்ணுறதுனால என்னன்னா உங்களுக்கு கம் டிசீஸோ இல்லை உங்களுக்கு டென்டல் கேரிஸோ இனிஷியல் ஸ்டேஜஸ்ல வந்து நம்ம அவாய்ட் பண்ணிக்கலாம். ஃபார் எக்ஸாம்பிள், எதுக்காக எனக்கு தான் வலியே இல்லை நான் அதுக்கு போய் டாக்டரை பார்க்கணும் அப்படின்னா, இனிஷியல் ஸ்டேஜஸ்ல இந்த சொத்தப்பல் இருக்குது அப்படின்னா யூஸ்வலாக உங்களுக்கு க்ளீன் பண்ணி ஜஸ்ட் அடைச்சி விட்டுருவாங்க. ஸோ இதில் உங்களோட சார்ஜஸ் வந்து 500 to 1000 rupees சார்ஜஸ் வரும். இது வந்து லைஃப் லாங் கேரண்டி, மேக்ஸிமம் எதுவும் ப்ராப்ளம் வராது. இஃப் சப்போஸ் நீங்கள் வந்து ரூட் கேனால் ட்ரீட்மெண்ட் ப்ரொசீஜர் போறீங்க அப்படின்னீங்கன்னா ஒரு ப்ராப்ளம் வந்த பல்லுக்கு தான் நம்ம ரூட் கேனால் பண்ணுறோம். ஸோ இது வந்து ஒரு லைஃப் லாங்காக நம்ம வந்து இது ப்ராப்ளம் வராதுன்னு சொல்ல முடியாது. ஸோ இட் இஸ் ஆல்வேஸ் ஒரு வர்றதுக்கு முன்னாடியே அதை ரெஸ்டோர் பண்ணி அதை பாதுகாத்துக்கிறது நல்லது. ஒரு ரெகுலராக ஒரு டென்டல் செக்அப் வச்சுக்கிறது நல்லது. ஸோ மை அட்வைஸ் வில் பி everyone has a family doctor. Similarly, everyone should have a family dentist. That's it, man. Can people lead to headaches? Headache problems have all. Yes, I said before, tooth problems has a direct link with the digestive system because யூஸ்வலாக பேஷண்ட்ஸ் பல்லு கெட்ட வர்றவங்க எப்போ வருவாங்க அப்படின்னா எல்லாம் விழுந்து முன்னாடி பல்லு டேமேஜ் ஆனதுக்கு அப்புறம் தான் வருவாங்க. ஏன்னா பேஷண்டோட இம்பார்ட்டன்ஸ் வந்து முன்னாடி பல்லு ஈஸ்தட்டிக் ரீசன், முன்னாடி பல்லு விழுந்துருச்சு அப்படின்னா தான் பல்லு கெட்டவே வருவாங்க. பட் வி டென்டிஸ்ட் மெயின்லி ஃபோக்கஸ் ஆன் தி போஸ்டீரியர் டூத், அதாவது பின்னாடி இருக்கிற பல்லு தான் மேஜரா இம்பார்ட்டன்ஸ் கொடுக்கணும். எதுக்காக பின்னாடி இருக்க டூத்துக்கு நம்ம மேஜர் இம்பார்ட்டன்ஸ் கொடுக்கணும் அப்படின்னா, இங்கதான் நம்ம எந்த ஒரு பொருளையும் கடிச்சு சாப்பிடணும். ஸோ நம்ம சாப்பிட்றதே வந்து மெதுவா எல்லா பொருளையும் கடிச்சு சாப்பிடணும். இதுவே வந்து நம்மளுக்கு இட் ஷுட் டேக் சம் டைம். நல்ல சலைவால பட்டு அது ஊறி நல்லா சாப்பிட்டாதான் GI ட்ராக் வயிற்றுக்குள்ள போறப்போ இங்க உங்களுக்கு பல்லு எதுவுமே கிடையாது. ஜஸ்ட் இட் அப்சர்வ் வாட் இஸ் தேர். ஸோ இஃப் தேர் இஸ் டூத் நம்ம என்ன பண்ணுவோம், டென் டு யூஸ் சைடு நம்ம யூஸ் பண்ணாம இருப்போம். ஸோ அதனால என்ன ஆகும் அப்படின்னா நம்ம சரியா கடிச்சு சாப்பிட முடியாத இருக்கும். ஸோ திஸ் இஸ் த ரீசன் ஃபார் சம் ஆஃப் த டைஜஸ்டிவ் ப்ராப்ளம்ஸ், கேஸ்ட்ரைட்டிஸ், அல்சர், இதுக்கெல்லாம் ஒன் ஆஃப் த ரீசன். ஸோ நம்ம என்னன்னா எந்த ஒரு பொருளையும் கடிச்சு சாப்பிடல அப்படிங்கிறது ரீசன். ஸோ இஃப் தேர் இஸ் டூத் kindly confirm with the dentist what is the procedure, what will be the treatment option. Next question. Is pulling safe for pulling is best. Nam oil pulling அப்படிங்கிறது வந்து இன் பர்டிகுலர் நான் என்ன யூஸ்வலாக அட்வைஸ் பண்ணுவேன்னா, நீங்கள் ஏதாவது ஒன்று பேசிக் ஒரு சால்ட் வாட்டர் காகிலிங்னாலும் சரி, ஆயில் புல்லிங் தவறுன்னு நான் சொல்ல மாட்டேன், யூஸ் பண்ணிக்கலாம். இட்ஸ் சேஃப், அது வந்து தவறு எதுவும் கிடையாது. பர்பஸ் என்னன்னா, த பிரஷிங்கோட பர்பஸ் எப்படி, ஜஸ்ட் ரிமூவ் த டெபாசிட்ஸ். அதே மாதிரி தான் நீங்கள் மவுத் வாஷும் அதே மாதிரி தான். நீங்கள் எந்த ஒரு மவுத் வாஷும் யூஸ் பண்ணலாம். பேஷண்ட்ஸ்க்கு நான் இன் பர்டிகுலர் எந்த ஒரு டூத் பேஸ்ட்டோ எந்த ஒரு மவுத் வாஷோ நான் அட்வைஸ் பண்ண மாட்டேன். ஏன்னா நார்மலாக ப்ராப்பர் பிரஷிங் டெக்னிக் ஒரு 5 நிமிஷம் நல்லா அழுத்தி வாய் கொப்பளிக்கலாம். அது நார்மலாக நம்ம டெய்லி பிரஷிங்க்கு அப்புறமும் வாய் கொப்பளிக்கிறதே நார்மல் ப்ரொசீஜர். அதுல கொஞ்சம் நம்ம மவுத் வாஷஸ் ஆட் பண்றோம் அப்படின்னா, ஜஸ்ட் இட் ஃபார்ம்ஸ் அ ப்ரொடெக்டிவ் லேயர். அதுல குளோரெக்ஸ்டின் ஒரு கெமிக்கல் இருக்கும். ஜஸ்ட் இட் ஃபார்ம்ஸ் அ ப்ரொடெக்டிவ் லேயர் அண்ட் இட் பிரிவென்ட்ஸ் தீஸ் கால்குலஸ் டெபாசிட். ஸோ ஆயில் புல்லிங், மவுத் வாஷ் எல்லாமே ஒரு ப்ரொசீஜர் தானே தவிர இட் மீன்ஸ் அ ப்ராப்பர் பிரஷிங் டெக்னிக். நல்லா அழுத்தி வாய் கொப்பளிக்கணும், அவ்வளவுதான். த மெத்தட் இஸ் இம்பார்ட்டன்ட். நெக்ஸ்ட் கொஸ்டின். How long the root canal treatment be useful? அதாவது the question is how long the treatment, you are asking the lifetime. So usually என்னோட பேஷண்ட்ஸ் நான் தான் சொல்லுவேன், ரூட் கேனால் ட்ரீட்மெண்ட் வந்து ப்ராப்ளம் வந்த பல்லுக்கு தான் நம்ம ரூட் கேனால் பண்றோம். இட்ஸ் ஒன் ஆஃப் த மெத்தட் டு சேவ் த டூத். ஸோ எந்த ஒரு டென்டல் கிளினிக்ஸ்லையுமே உங்களுக்கு ரூட் கேனாலுக்கு லைஃப் லாங் கேரண்டி நம்ம கொடுக்க முடியாது. ஸோ இட் இஸ் ஆல்வேஸ் பெட்டர் நீங்க அந்த பல்லு சொத்தையாகிறதுக்கு, பல்லு ரூட் கேனால் வரைக்கும் போற அளவுக்கு நீங்க விடாம ஃபர்ஸ்ட் ஆப்ஷன்லயே நீங்க ரெஸ்டோர் பண்ணிட்டீங்கன்னா அது உங்களுக்கு லைஃப் லாங்கா ப்ராப்ளம் இல்லாம இருக்கும். Root canal, again it is based on the condition that you reach the doctor. உங்களுக்கு உள்ளேயே ஃபர்ஸ்ட் 3 டைம்ஸ் உங்களுக்கு பெயின் வரும். அந்த ஃபர்ஸ்ட் 3 டைம்ஸ் வந்து உங்களோட பாடி மெக்கானிசமே அதை சரி பண்ண பார்க்கும். அதுக்கப்புறம் 4th and 5th டைம் தான் உங்களுக்கு பெயின் அப்படிங்கிற சிம்டம்ஸே உங்க பாடி சொல்லும். நீங்க அந்த டைம்லயே அட்லீஸ்ட் போய் டென்டிஸ்ட்டை பார்க்கணும். இல்ல நான் பக்கத்துல மெடிக்கல்ஸ்ல டேப்லெட்ஸ் வாங்கி போட்டுக்கிறேன், அது மாதிரி எதுவும் ப்ரொசீஜர் நீங்களே பண்ணிட்டு இருந்தா அப்படின்னா யூஸ்வலா ஃபர்ஸ்ட் மெடிக்கல்ல போய் டேப்லெட்ஸ் வாங்குற இதை வந்து கொஞ்சம் அவாய்ட் பண்ணிக்கணும். என்ன ரீசன் அப்படின்னா, கொடுக்குற டேப்லெட்டும் மெடிக்கல்ல கொடுக்குற டேப்லெட்ஸ் ரெண்டுமே ஒண்ணுதான். என்ன டிஃபரன்ஸ் அப்படின்னா, நான் கொடுக்குற டேப்லெட்ஸ் எதுக்கு கொடுக்குறேன்றதை தெரிஞ்சு கொடுக்குறேன். ஸோ சில பேஷண்ட்ஸ் என்ன பண்ணுவாங்கன்னா, என்னோட பழைய பிரிஸ்கிரிப்ஷன்ஸ் வச்சு அவங்களே திருப்பி டேப்லெட்ஸ் வாங்கி அவங்களே யூஸ் பண்ணிட்டு இருப்பாங்க. ஸோ திஸ் மேக்ஸ் த கண்டிஷன் வர்சன். ஸோ இனிஷியலா இன்னைக்கு தான் பெயின் வந்திருக்கு, நீங்க வந்தீங்கன்னா ஒரு 95% சக்சஸ் ரேட் இருக்கும் ரூட் கேனல்ஸ்க்கு. இஃப் ஃபார் எக்ஸாம்பிள் இஃப் 2 or 3 டைம்ஸ் எனக்கு இதுல பெயின் வந்திருக்கு டாக்டர் அப்படிங்கிறப்போ யூஸ்வலி இட் இஸ் 75% சக்சஸ் ரேட் இருக்கும். இஃப் த டூத் இஸ் மொபைல், டூத் பல்ல ஆட ஆரம்பிச்சிருச்சு அப்படின்னா யூஸ்வலி வி வில் நாட் அட்வைஸ் ஃபார் ரூட் கேனல் ட்ரீட்மெண்ட். தட் வில் பி 50% சக்சஸ் ரேட். ஸோ it is you have to decide at which stage you are meeting the dentist. அடுத்த கொஸ்டின். Sir, in 7 years old baby, some gaps in the upper and lower jaw tooth. How to reduce that gap? Ma'am, usually there's a stage called as an ugly duckling stage. Usually, குழந்தைங்கள நம்ம 6 years வரைக்கும் there will be deciduous tooth. As I said before, baby tooth, it has an importance of its own. Usually நம்ம அந்த டூத் அளவு சின்ன வயசுல கரெக்டா இருக்கும். After this 7 years, what happens is the jaw becomes, உங்களுக்கு அந்த மேல் தடை கீழ் தடை கொஞ்சம் பெருசாகிட்டே போகும். So what happens is there will be spacing. This spacing is normal because this creates the natural space for the permanent tooth to erupt. இது அழகா கொஞ்சம் ஸ்பேஸ் விட்டு இருந்தா மட்டும்தான் அந்த பெர்மனன்ட் டூத் எரப்ட் ஆகிறதுக்கான கரெக்டான சான்ஸ். ஸோ அட் 7 years அப்படிங்கிறது வந்து உங்களுக்கு 6 yearsல முன்னாடி 2 பல்லு வந்திருக்கும், யூஸ்வலா அதுக்கு முன்னாடி நம்ம குழந்தைய பார்த்தப்போ குழந்தை சின்ன வயசுல அழகா இருந்திருக்கும், வரிசையா எல்லா பல்லும் இருந்திருக்கும். இப்போ அந்த 6 இயர்ஸ்ல ஒரு ரெண்டு முன்னாடி இருக்க 2 பல்லு மட்டும் வரும். அந்த முகத்துக்கே அது ரொம்ப பெருசா வித்தியாசமா தெரியும். பட் தீஸ் ஆர் த டூத். அதோட 60 வயசு 70 வயசு வரைக்கும் இந்த டூத் தான் இருக்க போகுது. ஸோ இது வந்து நம்ம அந்த ஃபியூச்சர் டூத்துக்கு தான் நம்ம அதை வந்து கம்பேர் பண்ணிப்போம். ஸோ இட் இஸ் அ நார்மல். Next question, ma'am. Could you identify which company toothpaste is better? Any identification? To be frank, வந்து நான் எந்த பேஸ்ட்டுமே பர்டிகுலர் அட்வைஸ் பண்ண மாட்டேன். Because this is again a question, which soap is best? We can't answer for this question. So usually என்ன paste அப்படிங்கிறது I'll not be advising. I'll be mainly focusing to my patients on how to brush, the brushing technique. அதுதான் ரொம்ப முக்கியம். So whatever the paste வந்து நீங்க எது யூஸ் பண்றீங்களோ you can use it, it's not a problem. Certain conditions are there. If there is sensitivity, if there is gum disease, usually we'll be changing the toothpaste. If there is sensitivity, we'll be using this sensitivity paste or there to rule out that. Again, இப்போ எல்லாருமே ஒரு சேஃபர் சைடு இருக்கும்னு சொல்லிட்டு சென்சோரன் கேஎஃப் தான் நான் எல்லாருமே யூஸ் பண்றோம் அப்படிங்கிற ஒரு ஆப்ஷன்ஸ் இருக்கு. இட்ஸ் நாட் அ மஸ்ட். நீங்க என்ன பேஸ்ட் வேணா யூஸ் பண்ணிக்கலாம். ஃபார் எக்ஸாம்பிள் certain people's டாபர் பேஸ்ட் வந்து யூஸ் பண்ணி அவங்களுக்கு அந்த மின்ட் ஃபிளேவர் அந்த ஒரு ஸ்பைசி இருந்தா மட்டும் தான் அவங்களுக்கு வந்து ஒரு கம்ஃபர்டபுள் இருக்கும். நீங்க அவங்களுக்கு கொண்டு போய் நார்மல் பேஸ்ட் கொடுத்தீங்கன்னா அவங்களுக்கு அது ஒரு பிரஷ் பண்ண சாட்டிஸ்ஃபேக்ஷன் இருக்காது. ஸோ அகைன் இட்ஸ் யுவர் ஓன் திங். த திங் யூ ஹேவ் டு நோட்டிஸ் ப்ராப்பர் பிரஷிங் டெக்னிக். யூ டேக் சம் டைம் and visualize where the deposits are, clean it. And for young children usually வந்து there are certain paste, again these are fancy things. ஏன்னா குழந்தைங்களை நம்ம ப்ரொமோட் பண்ணணும். So you can குழந்தைங்களுக்கு வந்து ஆப்பிள். Thank you very much, ma'am. Any other questions, ma'am?
Thank you, sir. Thank you so much for your elaborate explanation about implant and root canal treatment. You gave much information and lot of tips for clean and healthy teeth. It is really an excellent session. By the way, we are wearing the smile what you gave for us today. Dear participants, we will meet tomorrow by the same time, same platform with another interesting topic. Thank you all.
Thank you, ma'am.
Thank you. Thank you so much, sir.
Thank you, ma'am.